people don't necessarily pay as much attention at the moment. Things are getting better, but people don't necessarily bother about checkups and things like that. It becomes a problem. And so there is a duty and responsibility. I mean, we have by no means conquered this disease. And I think it's one of the major problems in Africa today, sub-Saharan Africa especially, is sustainability. They start something good, but then sustaining it is a problem. And the HIV, it's not over yet. We still have over 30 million people, and access to, like I said the other day, I did a project the other day, and I was speaking to one of the, people in public health, and we're talking about drugs and, antimicrobials and HIV. With sexually transmitted disease, you also have the issue with antimicrobial resistance, where the drugs, we're struggling with treatment. So what we don't want is a case where there isn't as structured a system in terms of using antibiotics, so that you reduce the risk of resistance and you're still able to treat people. So you also have that issue on the back burner, but you also are in a situation whereby, if we don't keep on saying that message, we risk going back. We still have people that can't access medications. We still have the situation. I was talking to someone and they were saying that, the Global Fund is meant to give X amount of money. The government's meant to contribute this. Sometimes the government won't contribute their part. Sometimes they'll actually give it and take it back, and so, people start treatment, they can't finish it. So then they develop resistance. And I think this program I said that I was working with, I was speaking to one of the guys, and he was saying they were meant to pack up ship and leave, but they kind of couldn't leave, because if they left, all the work they'd done would go to pots, and mother-to-child transmission is becoming a huge problem. So we're not there yet. We haven't got to the promised land. And this is a disease that can be eradicated, and sexually transmitted diseases, by and large, are preventable.
Yeah.
But we've got to do our bits. And I really feel, and that's why I'm very, very passionate and I believe so much in prevention, because when I look at sub-Saharan Africa, you look at the health systems, the health structures in place, accessibility. The only way of managing the health system and keeping the balance is to educate and empower people, so that you minimize the number of people with these things. And like you said, we're talking about the masses. It's to educate and empower the masses that don't necessarily have the access is so important. And the good thing is that it just takes political will, because it doesn't cost as much as it would cost to treat these people.
I'll tell you something to all that you've said. One of the things is, in the Western world, because they found they've managed to contain it in such a way that if you have HIV and you go to the hospitals, you are put on certain drugs and, blah, blah, blah. And so the adverts and all of the awareness has come down. It's gone down at the same level all over Africa and places where it shouldn't go down. Yeah. And they're not getting cured. You can't walk into a hospital, they find out that you have this and they'll cure you.
Well, or like you said, there are places you can go to get free drugs, but the issue is also because this is lifelong treatment, and that's why prevention is important, and it costs money. So the issue is that because of the system and structure, like you were saying about the hospital, you go there, there's no drugs. What do you do?
Okay.